I'd like to welcome you to the Veterinary Meeting and Expo 2018. At this time, I would like to thank Multi-Radiance Medical for the sponsorship of this portion of our program. At this time, I'm going to turn it over to Mark, who's going to introduce our speaker. Thank you.
Thank you very much. Thank you, and good morning. Really nice of you all to get up nice and early. How many of you are very used to getting up this nice and early? Yeah, all of you, right? Well, we have a real treat for you. How many have known Dr. Schoen, have attended a past lecture over the years? How many have already met Dr. Schoen at one time or another? And how many of you are using acupuncture now in your practices? All right, terrific. Well, you know, Dr. Schoen's been around for quite a long time now, 38 years, a Cornell grad, and a professor at Tufts University as well, but mainly known as a groundbreaker, a disruptor, one who was always looking for new ways to do things better and looking for things that would work, and could it be repeated, and if it was safe, then it got his attention. And so in the early days of bringing acupuncture over to the US, it was pretty much blasphemy for a lot of people to think that this was even possible. But Dr. Schoen really was persistent because he kept saying his animals get better, and that's really his bottom line. So in this scientific investigation and finding out exactly how things work, it makes it much easier for the Western mind to grasp it. And so while the traditional Chinese medicine is so wonderful, now we're talking about the anatomy basis of acupuncture. And this is where now you as practitioners have been finding it very acceptable because there was now a great grounding understanding of it. So it's a great pleasure. I actually met Dr. Schoen here 4 years ago, and it's just an incredible pleasure. He walked in the room, he was scanning across the room, and we made eye contact and sat down and started talking. And then Dr. Nunez came by after that, and it just turned into a wonderful friendship. We've worked together for years now. So without further ado, please help me welcome, and by the way, he's here from Salt Spring, so it's a little early for him. It takes a lot to drag him off of Salt Spring, off of Vancouver, to come over here. So let's give him a warm welcome, please. Thank you.
Shall we, all of you, let me turn this on so you can hear me. How's that? How's that? Yeah, good. So, shall we? You're all here at 6:30 on Sunday morning. Thank you for coming. Okay, so my goal over the next hour is to share with you the excitement of, as Mark was saying, my goal and my career I've dedicated to pioneering new approaches to help animals that couldn't be helped any other way. And I actually wrote that in a note to my mother when I was 6 years old, that that's what I was going to do. I had no idea what that meant back then, but anyway, the journey has been a circuitous one, and with different detours and bumps. But today, what I'd like to share with you is this exciting technology of superpulsed lasers. And we're going to focus a bit on the technology and the techniques. I'm going to give you the gems and the nutshell of that. The details of it are all in what's called the pillar papers published by Multi-Radiance, where they put together all the latest research on superpulsed laser technology. I got excited about this in 2014, actually, when I met Mark here, because I've been using lasers in my veterinary practice since 1982, okay? And when I was here at NAVC 4 years ago, I said, oh, I'm curious about all these new lasers that are out on the market, and what's the latest technology, and what are they doing, what are their indications, what are their limitations, and how do they get integrated along with veterinary acupuncture and integrative medicine in general. And that took me to Mark giving me the lowdown on all of it, and I said, wow, this is really exciting. Then, because of some advancements that they've made in the last few years, what I realized is that this technology, one, okay, it's lasers. Two, you can use it to help stimulate acupuncture points. But three, it's so much more than that, okay? And that's where, let me just make sure it's pointers. Yeah, is that through the approaches that they've developed, this approach helps not only promote wellness in your patients, but also in your practice and in yourself, okay? Because that some of the latest stuff that I've been enjoying teaching for 15 years when I was a professor at Colorado Vet School as well as at Tufts is promoting our own, what I call mind-body medicine, our own wellness, because I always teach what I most need to learn, and because of being a professor at 2 vet schools, having my own 4 veterinarian referral practice and lecturing all over the world, I was beginning to experience burnout, and for the second or third or fourth time. And anyway, so what I started realizing is that this is the SuperPulse technology is actually not only just to help our animals, which is like the most important, but 2, it helps our practice, and 3, it helps ourselves. I use it on myself all the time, true confessions, okay? Once you start using it on the animals and then you start using it on yourself and you go, oh my gosh, this really works, then it's hard. My partner doesn't want to give it back to me, and she's like, no, it's mine. So anyway, fasten your seatbelts, because normally this is like a few-hour lecture. I'm just going to try to give you the gems, and the details will be in all the booklets. So, and just disclosure, I'm on the medical advisory board for Multi-Radiance, okay? So, and they're kind enough to be sponsoring me. I'm not going to go into my background anymore. You can read all about that, and Mark gave you a little summary. So, first thing to remember, this is the foundation of all forms of healing and for everything. And Tesla, as well as Einstein, both said this, is everything is energy, frequency, and vibration. Anything beyond that is an elaboration on that, okay? So that is one of the keys. If you really get that we are forms of energy, okay? And the frequency of who we are and what we interact with, the vibrational frequency, impacts on us. And impacts on our patients, impacts on everyone, okay? So this truly is the foundation for everything, and this is the foundation for laser therapy. Okay? Make sure to take that home with you, okay? Because if you get that, that is so deep and so profound. In my last book, The Compassionate Equestrian, which Mark will be handing out a little gift to you from as a good reminder from today, is I presented my 2 new theories, which we won't go into here, called the Transspecies Field Theory, okay, and the Compassionate Field Theory. And in that, I've combined the latest in quantum physics and neuroscience with the human-animal bond and veterinary medicine. Okay, and that's a whole other topic, but we'll talk about that sometime, I hope. So my journeys with laser, my whole career has been dedicated to pioneering new, non-toxic, innovative approaches to help animals when Western medicine and surgery was not helping or having side effects. Now, my key is I'm totally supportive and love conventional medicine and surgery. Okay, I'm not one of these holistic woo-woos that says, oh, Western medicine surgery is bad. To me, it's great. It's a foundation. I went to Cornell. I'm grateful for having that foundation. But my passion within a couple years out of vet school was I want to see what I can do to help the animals that are not responding to Western medicine and surgery, and what else can we do to help them? And that first led me into veterinary acupuncture, because at that time, veterinary acupuncture had the most research behind it of any of the different therapies. And then that took me on a long, circuitous journey. Okay, within the second course that I was taking in my training in veterinary acupuncture, I was there, and I began using the low-level laser therapy in my practice beginning in 1982. And so I was at this conference, and I walked in limping on my left hind leg, okay? And I walked in, and they said, oh, one of the instructors said, what's happening? I go, oh, I got kicked by a cow in vet school. I went to the orthopedist. He said, get used to limping. You have chondromalacia in your kneecap. And I went, oh, great. So he says, I can help that with laser. And I went, what? And I said, well, you know, I was just playing racquetball, and I ended up being lame for 2 days after playing racquetball, and I didn't want to give up racquetball. So anyway, he used the laser at that time, which was the most advanced one at that time of low-level laser, and did a treatment on my knee, and the next day I was not lame, and the pain went away instantly. And I went, oh my God. Okay, because like so many of us, we can understand the science, we can see it helping the animals, but when you experience it in yourself, it takes away all those questions and the skepticism and the cynicism, and you say, okay, the bottom line is this works. Okay, now I want to know how, right? So anyway, that took care of it, not just short term, but long term. Shortly after that, I bought my first laser and had been using it in my veterinary practice since 1982. But the technology wasn't living up to all the things that they were saying that lasers could do back then. And again, that's why the super pulsed is this newer next generation technology that really transforms it and starts addressing so many other indications for lasers. Okay, so that opened my mind to the therapeutic potential. And in the 2 textbooks I did, Veterinary Acupuncture, Ancient Art to Modern Medicine, and Complementary and Alternative Veterinary Medicine, back in 91, 98, I have chapters on photobiomodulation. That's another acronym for it, PBM, I'll just say now, or low-level laser therapy. And that back then we defined the mechanisms of action as photochemical and photophysical, not photothermal. And that's what we knew back then. There's so much more research on it now. And so I first started using PBM, or laser therapy, low-level laser therapy, to treat acupuncture points in 1982. And the reason the cases where I was using on are cases where either the animals didn't like having needles in them, or they were too nervous, too anxious, or the clients didn't like it. Okay, or I'll just give you a quick example. One that I was doing, a macaque monkey that had been rescued from a research facility, and it had nutritional fractures and everything, and it was paralyzed in its legs. And I inserted a needle into an acupuncture point, and immediately grabbed that needle and threw it back at me. I went, okay, this isn't going to work. And I pulled out the laser, and the laser was able to stimulate those points. And that's another one of those good indications of where laser may be more beneficial than using traditional needles in the acupuncture points. So the effects of combined LED and laser lights on tissue. This is the bottom line. It accelerates tissue repair. It stimulates rapid formation of collagen. It has a beneficial effect on nerve cells. Now they've found out that that's through the photostimulation of the mitochondria in the cells. And that's one of the foundations for the effects of low-level laser therapy, is it stimulates the mitochondria, so it activates cells that are not functioning properly. Then it has accelerated lymphatic system activity, increased blood flow and angiogenesis, and we all know wherever you can increase blood flow, it helps accelerate healing, except with cancer. Okay, and that's a separate thing, and I don't use laser on cancer, okay? That's one of the main contraindications, because you don't want to increase the circulation, obviously, to a tumor. And then what they've found now is the biophotons travel very quickly through the LCCC. What is that? The LCCC, or LCC, I'll just say briefly, is what's called the liquid crystalline collagen continuum. Okay, and when I was updating my research when I was a professor at Tufts Vet School on the neurophysiology of acupuncture, I came across Dr. Ho's theory called the liquid crystalline collagen continuum theory. When I read that, everything lit up for me, because I said, but prior to that, when I was trying to explain acupuncture beyond traditional Chinese medical theory, which is great, but in Rome, do as the Romans do. It didn't, when I was on staff at the Animal Medical Center and established the first department of veterinary acupuncture outside of China, I was accepted there because I was explaining it based on neurophysiology. I had a master's degree in neurophysiology, and I realized when I got into acupuncture that, oh my gosh, acupuncture is applied neurophysiology. Okay? But back then we were explaining it based on a vascular theory, a neural theory, an autonomic theory, but not one of the theories could explain all the effects of acupuncture, as well as they couldn't explain the speed of transmission of the effect of acupuncture throughout the entire body. And it was when I came across liquid crystalline collagen continuum theory that I realized this explains all of it. And we are a liquid crystal, just like our computers, the LED screens. We are actually liquid crystals, and I'll go into that in more detail. And interestingly enough, just recently, they found that they can use used LCD screens as tendon and ligament replacements in people, in animals, okay? And so, because LCD is a liquid crystal, and just every single month right now, I'm collecting more and more articles on documenting that how much of living beings we are liquid crystals, okay? Now, the liquid crystal, another term that we're probably more familiar with is fascia, connective tissue, okay? All the stuff, do you remember in first year anatomy in vet school when you were ripping through all the fascia to find the muscles and the nerves and this and that, and you were taught, oh, that's just connective tissue. That fascia is a tremendous bioelectrical communication system throughout the entire body. That fascia wraps around the acupuncture points. It wraps around the skin, it holds our skin together, but then it wraps around all the nerves, all the blood vessels, all the lymphatics, and it wraps around the acupuncture points. And what they've found now is that is the bioelectrical communication system, and it wraps around the spinal cord. It goes up through the glial cells, up into the brain, and that's the only way that acupuncture can work so quickly through the entire body. A number of years ago, they did some nuclear magnetic resonance studies and functional MRIs. Okay, it was actually, this study was on functional MRIs. And they treated a point in humans called bladder 67, which is on the outside of your little toe, okay, all the way down there. And then within seconds, the area in the prefrontal cortex for vision, the optical cortex lit up. And in Chinese medicine, they talked about that thousands of years ago, that point is for improving vision. But none of the previous theories of vascular, neural theories, none of them could explain that speed of transmission. But the liquid crystalline collagen continuum explains that, okay? So that's one of the other take-homes. If we realize that we are this biocommunication network based on fascia and connective tissue, and it's a liquid crystal, all of a sudden we light up and we realize, oh my gosh, this has so many implications. And one of the implications is this is how biophotons, light energy, is transmitted through the body so quickly. So this is what I started realizing when Mark Strong and Multi-Radiance was explaining to me how they have some patented synergistic wavelength frequencies in this particular superpulsed laser that work synergistically and are transmitted through the liquid crystal. Okay, and I have numerous articles on this that explains the liquid crystalline continuum, and there's so I'll do this just quickly here. Forget that thing over there. But it's the most abundant protein in the animal kingdom is collagen, okay? And collagen, 70% of all protein of connective tissue, is the bulk of the body, and the collagen has the bioelectrical conductive properties. So we are a bioelectrical communication system. Our dogs, all living beings, are a bioelectrical communication system. and that is based on fascia, connective tissue, and the liquid crystal. So it takes this liquid, the liquid crystalline matrix, it takes the collection of collagen into parallel array structure to produce its ability to conduct and store this energy. So here you have a polypeptide chain, and then these chains are triple stranded into the collagen molecule at 300 nanometers in length, and then these collagen, these triple-stranded collagen molecules wrap together, and they form this collagen fibril. And this is this bioelectrical communication system. The electrical properties of this connective tissue explain how cells can communicate much faster than the comparative speed of neural transmission. You following me? It's all right, it's all in notes that you can get from multi-radiance, but I'm just trying to give you the essence of it. So the other part of the liquid crystal, besides collagen, is called bound water. And Dr. Pollack at the University of Washington in bioengineering, he'll get a Nobel Prize for this, no question. He discovered the fourth phase of water between liquid, ice, and steam. The fourth phase is called bound water. And what it is, bound water is the structuring of water on solid surfaces. So 50 to 60% of cell water is structured in a microtrabecular lattice that fills the entire cell, which gives the cell solid state-like characteristics, right? So we have this cell, and we think we know what it is, but really, inside it is this liquid crystalline structure of bound water and collagen. And not only is that within the cell, that's in the connective tissue connecting all the cells. So what this is an ordered network of water molecules connected by hydrogen bonds and interspersed with the protein fibrillar matrix of collagen that supports the rapid conduction of protons, the positive electrical charges. This is the only way that this can be transmitted so rapidly throughout the body. So the acupuncture pathways in this bioinformation transmission is through this continuum of the liquid crystalline collagen fibers of connective tissue. And the bound water layers on the collagen provide the proton conduction pathways for the intercommunication throughout the body. So, and again, it's, if you look up, if you just go to YouTube and you put in Dr. Pollack, fourth phase of water, all of this is explained. He gives his lectures from the University of Washington on his YouTubes. Brilliant, okay? And so this is the bioelectrical communication pathway. Collagen and water are the two best conductors of electricity. If you want to read about this more, Dr. Ho, who I contacted when I read about her theories, and she gave me permission to represent them and present them in veterinary medicine, she wrote a book for the public trying to explain all of this. So, unfortunately, she's deceased now, but it's called The Rainbow and the Worm, okay, the physics of organisms. So this is integrating the latest in biophysics, the latest in quantum physics, and the latest neurophysiology with veterinary medicine, and then you'll see shortly how that relates to the human-animal bond. So essentially, the liquid crystalline continuum, LCC, is defined as states or phases of matter in between solid crystals and liquids, what are called mesophases. When it's solid, you know, we have a crystal, okay? When it's completely liquid, it's much more fluid. And this is a mesophase between them that is what gives our cells and our whole body all the structure. So it undergoes rapid changes when exposed to electromagnetic fields. That's a whole other lecture. As you're, I'm sure, aware, the electromagnetic fields can be used beneficially, or they can be extremely hazardous to our health, depending upon, again, frequency, vibration, energy. You know, from microwaves destroying us, Wi-Fi being destructive, to certain electromagnetic frequencies and wavelengths that are beneficial, that help accelerate healing. And these mesophases respond to changes in temperature, hydration, and pressure. So when in the ancient Chinese medicine, they were talking about how the environment affects the impact of acupuncture and acupuncture points, now we're able to understand better how that is impacted. So all major constituents of living organisms may be and are now known to be liquid crystals. The lipids of cellular membranes, DNA, proteins in the connective tissue, proteoglycans are all liquid crystalline matrices. That's a nice picture of them. All the energy in it. And then again, nuclear magnetic resonance studies of human muscles provide evidence of the liquid crystalline-like structure of muscles. Connective tissue, once thought to be merely mechanical connections of rigid elements, like I said, just keeping everything together when we were ripping through it in anatomy, it's now considered, the connective tissue is now considered a global tensegrity system in which compression elements, bones, are interconnected with tension elements, muscles, tendons, and ligaments, responsible for the rapid communication throughout the body. So the connective tissue connects everything like that, but even more importantly, it is the bioelectrical communication system. This is the NMR of human muscle tissue, showing these parallel array structures of collagen, which I was showing you in an earlier slide. So this collagenous liquid crystal mesophase of the connective tissue with their associated structured water constitute a semiconductive, highly responsive network that extends throughout the body, and it connects the skin to the brain to everything in between. It's directly linked to intracellular matrices of individual cells via the proteins that go through the cell membrane. And the connective tissue and the intracellular matrix form this global tensegrity system and creates an excitable electrical continuum for rapid communication. You got that memorized? Okay, that's what you need to get the CE credit for today. So these DC direct current electrical fields and the acupuncture system have this common anatomical basis. And this is what excited me too, because skeptics are saying, I don't see acupuncture meridians. Where are they? Are they this, they that? Well, they're in the fascia, okay? And once we're starting to use more and more, oh, I don't know why that keeps on coming on. Okay. Once we start using more and more diagnostic tools, we can start seeing all of that. Okay, that's that one. So now let's just review a little bit on low-level light therapy and the mechanism of action and how that interacts with the liquid crystalline. Okay, the other term for it is photobiomodulation. That's the new accepted term for low-level laser therapy. And it goes and is transmitted through this liquid crystal, and that again explains the rapid generalized effect where it's not having it just on the local area, but systemically throughout the body. I'm going to give you the gems, the nutshells here. You can read the details in the notes, okay? Because at 6:30, 7 o'clock in the morning, there's no way in the world I can expect you to all memorize this. So the simple method of action is light penetrates through the skin and it's absorbed by the mitochondria in the cells. Cells that start getting degenerated and stuff, they have decreased energy, and so they don't function as well. And that's when you get arthritis, degeneration, cancer. And the goal of the light therapy is to help regenerate the activity, the energy in the cells, no matter where it is. Additional energy assists cells to enhance healing and enhances the restoration of normal cell function. So that's one of the bottom lines with low-level laser or photobiomodulation or biophotonic modulation, is that it helps return normal cell function, wherever that is. And essentially the photons, the light is absorbed in the mitochondria, it increases protein synthesis and cell proliferation and activates tissue repair and improves pain control and increases ATP synthesis, and that's in a nutshell. That also shows why you don't want to use it around cancer, okay? Because it doesn't, at this point, there is not enough evidence to say one way or another, but precautionary principle is if it's increasing circulation, increasing activity, Right now, there isn't evidence one way or another if it does increase cancer cells too. Okay, so my attitude is, even with acupuncture, I won't do acupuncture around a tumor. Okay, there's certain points you may use to help stimulate the immune system to help fight it off, but that's the one place I don't use it. So the simple science: photons are absorbed by chromophores in the cellular mitochondria, generating ATP, nitric oxide, and ROS, reactive oxygen species. This energy then fuels other physiologic responses, resulting in restoration of normal cell morphology and function. Multi-radiance, of all the different lasers that I walked into the exhibit hall here in 2014, and I said, okay, there are all these different laser companies. I need to update myself on which ones are doing what. And that's when I started realizing and educating myself there's a big difference between class 1 and class 4 lasers. Many vets have class 4 for surgery and this and that, and then they're saying it can be used for therapy as well, but actually the research doesn't document that. So the synergistic wavelengths in the multi-radiance, the ActiVet, they have over 30 years have developed these, and the original research was from Russia, that they found these synergistic wavelengths of a blue LED, 465 nanometers, which is in that, and they can explain that to you more at the booth. And then there's a red LED at 640 nanometers and infrared LED at 875 nanometers, and then the superpulsed infrared laser at 905 nanometers. The superpulsed is what allows this laser to penetrate deeply into the skin, into the muscles, into the joints, without heating them. This is one of the key differences, okay? Is class 4 causes thermal effects, which if you read the fine print can cause damage, okay, to the cells through the thermal effects. What this does, it penetrates deep into the joints without any heat and without any pain. The superpulse technology is able to permeate like that. And again, what I find is when I see that experience on myself, when my hips are bothering me, my neck or my shoulders from, at the peak of my career when I was doing a significant number of horses, I was doing 30 horses a day. Big horses. These are the big warm bloods, not little, ponies or anything. And it was taking its toll on me. But I was the only one in the Northeast at that time doing it. And subsequently, as we age, I like to think I'm aging to saging, but the other parts of me are just calling it aging. And so I use that laser whenever I'm traveling. I use it at home on myself. And when you see it, feel it, experience it on yourself, you go, oh, okay. And then Mark was telling me about one horse that was trying to kill every veterinarian that went nearby, near its hip, and because it was so painful in the hip. And it was an Olympic veterinarian, and they said, okay, you think this can really do something? Try it on that horse's hip. It tries to kill you, anyone who goes near it. So he used it, showed him how to use it on the hip, and you know the depth of penetration for a hip, right? On a horse, all of a sudden this horse started falling asleep. Okay, and that's what I've seen when I use it on the horses. Even going so deep, no thermal effect, no damage, super safe, and it penetrates that deeply. So these are the things that, again, open my mind, because I've never actually lectured being sponsored by a company, because everything I did was natural and no one wanted to sponsor it, okay? So it's only because this is so effective that I got so excited and say, I'm willing to do this for you guys, because my goal in my whole career is how can I help animals and people? And so, again, that's why I got excited about these wavelengths. And going back to Tesla, everything is energy, vibration, frequency, wavelengths. So the photobiomodulation, it's so important to realize this is non-thermal and has only been shown to occur with low-level laser and LED devices, not with high-powered class 4. So take that one home, okay? Class 4, can cause thermal damage to cells. It's been known to burn animals. If you look at the fine details on it, okay, and you read the fine print, you're supposed to be wearing the glasses. There's a whole protocol that's supposed to be done that's rarely used, but that's to protect yourself and the animals from burning. Okay? And not that there isn't indications for class 4, okay? But as far as safety goes, this is where the class 1, the Activet laser is labeled class 1 because it's so safe. That means anyone can use it, okay? And it doesn't burn. So it causes release of nitric oxide. And nitric oxide has both a direct and indirect impact on pain sensation. Directly, it acts as a neurotransmitter, and it's essential for normal cell, nerve cell action potentials. And indirectly, it causes vasodilation. That's what we know mostly about nitric oxide. So it enhances nerve cell perfusion, oxygenation, inhibits the release of histamines, inhibits prostaglandin synthesis. Some of the more recent research on the physics and biomedical effects of blood oxyhemoglobin photodissociation, can you say that quickly at 7 o'clock in the morning? Is the molecular oxygen is generated due to laser-induced photodissociation of oxyhemoglobin in the blood vessels. And so essentially what it does, it separates the oxygen from the hemoglobin, and it's a unique method in laser therapy. So it helps get the oxygen into cells better. Next is increase in microcirculation and tissue oxygenation. Okay, the increase of blood flow after laser therapy is an important factor in pain relief. The molecular oxygen is generated due to the laser-induced oxyhemoglobin dissociation. It increases lymphatic drainage, and then the activity of neutrophils, macrophages, fibroblasts, and the metabolism of damaged cells. I don't know why that one's so fast, but okay. So essentially, it's penetrating through and causing vasodilation. Okay. So the bottom line, here are the quick synopses. It causes reduced pain, stimulation of beta endorphins, reduced release of histamines, bradykinin, substance P, and acetylcholine. It causes a decreased C fiber activity by blocking depolarization, stimulated replenishment of neurotransmitters at the synaptic level, increased nitric oxide, increased nerve cell action potential. And all of that attenuates the effects of inflammation. So in a nutshell there, it has anti-inflammatory effects. It reduces swelling by reduction or disappearance of ischemia in the tissue. Again, anti-inflammatory effects penetrating there. Okay, and you can memorize all of these. Again, increased beta endorphins, all of that is in the notes. Again, and it works both in acute inflammation as well as in chronic inflammation. And again, I see it in the dog patients, the horse patients, the cat patients that I've treated with it. I see it all in them. But the bottom line is when I felt it in myself, I went, oh, this is what all my patients are feeling. That's really cool, okay? And I think we all like to know that. You know, we can understand it. We can see the animals relax. We can see them walking better. We can see them functioning better. But boy, nothing beats feeling it in yourself. The effect of laser therapy on inflammation, all of that's in the notes. Okay, so to summarize, the superpulsed laser effects on inflammation. Decreased number of neutrophils, decreased biochemical markers such as cytokines and C-reactive protein, the release of nitric oxide, and improvement of microcirculation and photodissociation. The phototherapy effects on wound healing through, again, a non-thermal series of processes, increases macrophage, enhanced leukocyte infiltration, on and on. All the things that accelerate wound healing. And then there's another approach using the laser called photohemotherapy. Again, this is related to the dissociation of hemoglobin, and hemoglobin is in RBCs is very photoreceptive. So what you can do is treat the artery proximal to a target tissue. Hey, so like in a horse, if you want to treat the stifle of the hock, you'll target the femoral artery. Same with dogs. Okay, and the red blood cells will pick up the photons and carry them to the inflamed tissues, causing an increased free oxygen and nitric oxide. You can use it for lymph therapy to relieve swelling. You target the lymph nodes proximal to an injury or swelling, and there are different frequencies. They'll go over all the different frequencies with you, okay, at the booth, and it's all in the notes, because different frequencies have different effects. And that's what's beautiful about the Activet Pro. It has all these different frequencies, and they have the manual with it, depending on whether you want to stimulate acupuncture points, whether you want to stimulate cells, whether you want to relieve pain and inflammation, all the different frequencies. There are different frequencies for each one. Okay, so I want to focus here on the conclusions. You're getting all of this? Is it making sense? And how the liquid crystalline collagen continuum theory is kind of like the golden nugget to explain all of this biophotonic stimulation, how it works throughout the body. So there are numerous practical applications to accelerate healing for so many conditions. But these are the three things that I brought into this that I said to Mark, I said, this is so much, where the human-animal bond has become so big, thank God, and everything. 30 years ago, I was pushing for certification human-animal bond, but people didn't even know what that meant back then. It's nice to see it here now. But, okay, the subtitles for this lecture: promotes wellness for approach for animal care. This is one of the things I love, is with this particular technology, because it's super pulsed, and with that it's so safe, class 1, your technicians can use it easily. And then Multi-Radiance just developed a pet rental program, and they also have it for equine, but where your technicians and your staff and everyone can rent out the smaller laser. Okay, there are a few different ones. There's one that's smaller, it has limited frequencies that you can rent out. I have to figure out how to stop that. So you can rent it out to your clients. So your technician can do the treatment when the animal's in the hospital, and then you can rent it out. Your technicians can show them how to use it, and then they have this thing, Mark, the POG. He'll go over that. Now that they have this POG that is attached to the laser, okay, and you use it through your cell phone. He's holding one up, okay, and he'll go over that, so that the instructions go home with the client. If they're going, what did that technician say? And how do you use this? You tap the POG on the laser, and then on their cell phone, all the instructions of how to use it for them show up. It couldn't be easier, okay? Then, with that, one of the problems with use of laser and acupuncture is lots of animals, how many of them, they don't like coming to the vet? Everyone is busy with schedules and this and that, and then there's traffic and everything, and they go, oh, well, yeah, it'd be nice to come every day, or it'd be nice to come 3 times a week or twice a week. I have kids, I have this, I have that, I work full time. Nice thing about this, you take it home, you have the clients take it home, they can do it every day, okay? They're sitting at night watching TV, their dog, their cat is sitting in their lap, or if it's a big dog, on the ground, and in addition to petting them, you're just going over them with the laser, and they're healing. You're doing the treatment, and it doesn't have to be acupuncture, it's any type of healing to relieve pain of arthritis, chronic degenerative diseases, all of that. They're doing at home, and it's bonding them because the animal, their animal companion, is feeling better, getting an endorphin release and healing with this laser. So then, does the name Pavlov ring a bell? If every time that they're getting the laser at home, they're feeling better, the dog, the cat, they come up And it's the same with acupuncture. The dogs and cats, the horses, once they know what I'm doing, they all come up to me. The dogs will back into me and show me where they want to be treated, okay? And that's what's so cool, because talk about human-animal bond, we're bonding at that level. They're going, oh my gosh, every time I see that thing, and my mom, my dad, they're going and using it, I feel better. What could be better than that, okay? And with the rental program, you can do that. So that's part of the wellness. Then promotion wellness approach for your personal care. You go and you start feeling, you see it, you end up, so many vets like myself, I get one for myself because I want it around for myself and my family. And then third is it provides passive stream of income to help prevent burnout and decrease financial stress. We all know about burnout. That's one of the other passions I love lecturing on because, again, I teach what I most need to learn. And one of the great stresses is financial, right? And where pharmacists, prescriptions are going out the door, everything's going out the door. What this does is you get a passive stream of income by renting these out. And your technician can manage it all. They manage the whole rental program. It shows you, they have on their website and on the app how many of the lasers are out, where they are, how much they're generating for you each day. There's one big practice that has 15 of these lasers rented out to their clients, and they just keep on buying more of them because it provides a nice stream of income to you that's passive, that your technicians can do, and it relieves our stress, our financial stress. So, bottom line is satisfaction of doing no harm if using the appropriate laser, class 1 lasers, and the techniques. Satisfaction of doing good, accelerating healing, providing care. Satisfaction of your ability to provide treatment anywhere so your clients don't have to come in all the time. And client satisfaction for being part of their pet's therapy. The clients say, I am so grateful that when I can be doing this at home and I'm part of the whole program, and it empowers them to be part of the healing process. Okay? So the benefits, class 1 safety versus class 4 potential hazards, the thermal hazards. The red and blue lights are synergistic. I didn't even go into that, running out of time, is the blue light is used for treatment of MRSA, okay, and other bacterial infections. And they can talk to you more about that because I'm running out of time, I guess. And the safety factor allows clients to use the class 1 at home, increasing client compliance, which is always a challenge, and thus patient outcomes. So to me, it was a no-brainer. When Mark explained this to me, I was like, duh. Okay? And the benefits of the Super Pulse, the clients are able to rent them from you as veterinarians for use at home with patients that do not tolerate travel well. You know, the cats that freak out going in the cage, in the carrier, boom, they're doing the treatment at home. You're checking on them, you're getting feedback through your technicians and everything. The dogs that, put on the emergency brake when they come into the exam room, you just teach them how to do it, and then they can do it at home and come in for follow-ups. Clients feel empowered by being part of the healing process and enjoy treating their animal companions at home. And then the thing that was so important to me was the peer-reviewed research. This laser, this Super Pulse technology is science-based, which my whole journey, I was always looking for where is the science for these things. And again, your patients appreciate the increased attention at home. It provides the safe, new, significant form of passive income. This is the rental ones that you rent out to the clients. The more powerful ones are the ones you use at home, use in your practice. Ease of monitoring home use, income streams, it involves vet assistance for support. So it's a win-win-win for your patients, for your clients, and for us. So thank you so much for showing up so early in the morning. Kudos to you. Thank you for caring for your clients and your patients and yourself. And thank you for being you, because you are all amazing. In all the craziness and the chaos in this world, we as veterinarians, and this is a whole other lecture I give, are part of the healing of the world. Okay? Take that in. Okay? I give a whole lecture just on that, the neuroscience, the quantum physics of how we can be so much more, and we are helping heal the world, as crazy as it is. And again, if you read, I'll be doing a small animal version of the book, will be coming out soon, but my trans-species field theory and the compassionate field theory, again, based on quantum physics and neuroscience and combining it with the human-animal bond and veterinary medicine. So, and there's more information, I'll take the question in a second, thank you, is talk to them at Multi-Radiance at booth 723. And I know at this point you're saying, may I be excused? My brain is full. Oh my gosh, thank you so much for showing up at this morning. And if you want to contact me, my email is schoenoffice, oddly enough, at gmail.com. So thank you so much.